All right, the athletic fields at just about every school in Central Ohio are filled with young athletes pushing themselves to be the very best. But at what cost to their bodies? This time of year, ACL injuries are on the rise, and it may be surprising who might be suffering from those the most. So with us today from OrthoNeuro, we have Dr. Rodney Comisar joining us. So good to have you back, doctor.
Thank you, Robin.
So orthopedic surgery and sports medicine are kind of your specialties as we talk about this. Let's just start with the basics then. What is an ACL injury?
Well, an ACL refers to the anterior cruciate ligament, which is a ligament in the middle of the knee that resists translation of the knee, both in the anterior to posterior plane, but also in a rotational fashion, important for cutting sports.
Okay, and cutting, you know, if somebody is not in the sports, is that anything you're kind of diagonally moving?
Got a lateral translation, sometimes even landing from a jump, you can injure ACL. So we see it a lot with the fall sports, football, soccer, both men's and women's, as well as volleyball.
And I did find it interesting when you talk about the genders. How does this deal with female athletes versus male?
Well, it's interesting that there's studies reflect that the injury rates in young females are anywhere from 2 to 8 times that as in young males, which is alarming.
Yeah.
There's really multiple reasons for that. There's some anatomic reasons about how our bodies are designed, some hormonal reasons with respect to estrogen and other receptors on the ligament, and lastly some differences in how neuromuscular patterns of muscle firing engage. So hamstring and quadriceps firing at different rates can all influence the injuries.
Yeah, that's interesting. All right, is it just to, as you mentioned, you know that factor plays in what kind of sport they're playing, what kind of position they're going. But as we develop, I mean, you say young athletes, are they more susceptible because of their age than maybe an athlete who's been playing longer?
Well, we see it a lot in young athletes. It may be just their relative immaturity from a musculoskeletal development standpoint.
Okay.
Also, they're participating often at a little more frequent level than, say, some of our recreational athletes who have jobs and as opposed to being in high school or college.
Okay.
And it's really multifactorial.
And then when you talk about symptoms, signs of this injury, how do you know it's not just, hey, a sore knee, you worked it out too much, that it may be something more serious?
Well, with an ACL, it tends to be an event. It doesn't just happen. So it's more of a, I felt a pop or a shift in my knee when I landed from a jump, or I got hit from the side with my foot planted. So it tends to be an event. It won't just happen spontaneously. Generally with that, there's a fair amount of swelling that occurs within the first 24 hours. But some patients may be able to walk off the field, whereas others aren't able to weight bear and might have to be helped off. So they can present in a lot of different ways. All
right, what about treatment options?
Well, there's certainly a lot of ways to treat these. Surgery is not your only option, but it's the preferred option really, and especially in young active people and really people of all ages that are involved in sports, just because it's very difficult to go back to cutting activities or rigorous jobs without an ACL.
Right.
Without the risk of re-injuring it in a similar manner. And then what happens is once it's torn, it's torn. So you're not going to necessarily re-injure it per se, but you put some of the other structures in the knee at risk, the cartilage of the meniscus cartilage, the articular cartilage, which is the kind of the coating on the end of the joint.
And you kind of alluded to this, for these kids, the hours of play they get in is sometimes pretty intense. So should they cut back on that? Should they do that now? Do they wait until an injury and then they need to cut back? I guess, how do you withstand that and still play the sport you love?
Well, it's interesting. We think some of it's just volume of participation. So number of hours in the playing field. Certainly fatigue can be a factor in knee injuries. The biggest thing we see at the youth level is sports specialization. Once upon a time, most children participated in multiple sports depending on the season.
Sure. Nowadays
there's this tendency to early specialize to be better, maybe achieve a level where you can play in college. However, studies seem to reflect that those patients that are involved in year-round participation in certain sports like volleyball, basketball, soccer are at a higher risk of injuring their ACL. We think participating in other sports kind of creates some complementary skill sets, if you will, that protect the athlete, and also just an off season of 3 to 4 months or so gives them a break in a sense, and let their bodies heal up so they don't, you know, keep going. And sometimes it's a numbers game. You play enough games, your number may come up, unfortunately.
Is there any way to prevent, are braces helpful, are physical other exercises helpful at all?
The braces aren't protective. They may lessen the severity of an injury, but they won't prevent an ACL injury if you didn't have one or if you've had one and are going back. However, there are some prevention programs that have started in Europe and are kind of making their way to the U.S., primarily at the soccer level, where they basically try to introduce some strengthening programs and different ways to land and cut that, with repetition, may teach patients and their neuromuscular wiring to avoid some of those dangerous activities or positions that may contribute to injury.
All right, and if you do end up with the injury, obviously finding a professional, somebody who specializes in that, is the best way to go about getting help. So you can find all the information about the team at OrthoNeuro on the screen right there. Doctor, thank you for being here.
Thank you, Robin.